president of the Senior Care Alliance. We have an awesome team. Our board is Ashley, who's the vice president. DJ, who works for Mercy Rehab, who's our treasurer and not here. Brittany, down there, is our secretary. Louise is the one that keeps us all together. She's our coordinator. And Jessica, who works at Encompass, I don't think she's here. Mandy is here somewhere. She's a board member. Teresa is here, over here. Sarah, there she is. And Crystal Lujan, Adriana back there. And did I miss anybody for board? I didn't miss you, Candace. Yeah. No way.
You did.
And Cassie. So, Candace is our previous president. So, thank you for being here, our previous president, Candace. And Kurt. I'm so sorry. In addition to the board, I wanted to let you know we have several committees, and typically in our organization, most of our committees have been board members, but we want to make sure that you know what committees that are here, and if you're a member of Senior Care Alliance, we'd love for you to serve on those. We have a bylaws committee, which is me, a nominating committee, which is Candace, conference committee, which is Louise, and coffee talk committee, or sweet connections committee, which is Teresa. Membership committee is me. Ashley is community liaison, and Brittany coordinates our general meetings. So we have lots of committees. If you're interested in serving on any of those, please see those folks. In the entrance where you signed in, there's lots of information. If you're not officially a member, we'd like for you to fill that out. There's also information about our conference that's in September, which, by the way, is awesome. And also our resource directory. We are going to be updating our resource directory. We completely ran out of copies last year, which is awesome for those people that sponsored the resource directory. We send those out to providers. We use those in our Sweet Connections, and so there's lots of opportunities for you to have exposure if you sponsor the resource directory. So, our upcoming next meetings are at the Reynolds Cancer Support House, which is a beautiful building. For those of you who've not ever been in there, it's going to be on February the 25th. And then our next Sweet Connections, which is where we educate our seniors at the senior centers, is in Mountainburg on February 10th. If you are a member and you would like to have your information presented to the seniors at Sweet Connections, please make sure you give your brochures or wrap cards or anything that you'd like for our seniors in the community to know about you to Louise, and she will make sure, because every senior at our Sweet Connections gets a resource bag. Whew, that's a lot. Talked really fast. So, without further ado, I want to introduce our sponsor and thank her for sponsoring and inviting us to her beautiful building. I believe she's going to be offering tours afterwards, which I'd like to sign up for that. And it's Patricia Clark, Executive Director with WellQuest. Thank you.
Thank you. I'd like to thank everyone who came out in this weather today to join us. We are the River Valley WellQuest Future PACE Center. We found out last week that we were approved. Our opening date is, our opening date is April 1st, tentatively. There's a small window of possibility that it may be March 1st. So, how many people in here know what a PACE Center is? I didn't. Okay, wonderful. Well, a PACE Center is a program, it's an all-inclusive care program for our elderly in the community, 55 years of age or older. So, okay, that makes sense, all-inclusive. That probably means that all the services will be provided here, correct? Yes, that's absolutely correct. I'm going to be doing tours. We have a medical clinic in the facility. We have a therapy clinic in the facility. We have a counseling office in the facility. We have a dietitian that will be on staff. We have a recreational therapist that's on staff. We have clinical RNs. We have quality assurance director. So I'd like to introduce our team real quick. So if you'll stand up and just tell us a little bit about yourself so everyone will know who you are. I'll start with person closest, Katrina Coquet.
Yes. Hello, ladies. I am going to be the marketing specialist for the PACE Center. Hope to get to know all of you. Very interested in the Senior Care Alliance, being part of that. For the past 15 years, I owned Coquet Bath Company, which was a small business here in Fort Smith. We made soaps, scrubs, bath bombs, you name it. I recently sold the business to another lady who's going to continue on, and I decided it was time for a change, so this is my change. My background is marketing and sales, so I'm looking forward to really promoting the PACE Center, really getting out there, doing a grassroots effort to really build this up because it's amazing. PACE is an amazing opportunity for our elder community to come here and get everything. So, it's my 1 minute up. So,
Thank you.
Thank you.
Thank you. Next is Chris. Thank you. Chris Smallman. She is our clinical RN.
I've been an RN for 34 years. I've done a little bit of everything, but my heart has always been senior health. So I'm excited. This has been a needed thing for years and years. I wish I'd have thought of it, started it myself, but that's okay.
Thank you.
Thank you.
Amanda Cheatham is our APRN for our clinic.
Hi. So I'll be here in the Ashton Place at the nursing home rehab, and been a nurse practitioner for 6 years, recently in the hospital setting. So welcome to the PACE Clinic. Hopefully you can refer people here so I can start providing care for them.
Thank you. Our medical director is Dr. Kristen Chappie. She just had a baby last month, so she's not joining us today. She's a great person, very down to earth, very easy to talk to. We have Lori Peters, who is our medical records specialist.
Hi, I've been in medical records and billing for over 26 years. So I'm looking forward to being able to be here and work with our senior population. Thank you.
Wonderful. Sandra Paver is our quality assurance director.
Hi, I've been an RN longer than I'm willing to tell you guys how long, but most of my career has been in hospice, 28, 29 years, and recently long-term care for about a year and a half. I'm very excited about being here.
Wonderful. Thank you, Sandra. And last is Ebony Jordan. She's joining us as our recreational therapist.
Hello, my name is Ebony. I've been doing activities since 2015. I love to spend times with the residents and do activities with them, so nice to meet you all.
Excited to have you. Would you like me to go ahead and talk about the program or each person?
Yeah.
Go ahead. Okay. So the PACE program, what are the requirements to be able to be a participant on our PACE program and come to our PACE center? There's 4 requirements. You have to be 55 years of age or older. You have to live within our service area, and that's Franklin County, Johnson County, Crawford County, Sebastian County, Logan, and Scott. Okay? So that you have to be an Arkansas resident. You have to be of a nursing home level of care in which you need assistance with ADLs and IADLs. That makes sense. That's a good population. They can benefit from all the services we offer here. And then last is, hold on just one moment. be able to live in the community safely with the PACE program present. So we bring safety into their homes or into any assisted facility that they might be in by offering several different services, which I'll talk about in just a minute. So, what's a typical day gonna look like here at the PACE Center? Let's say it's your mother or your father, and they come through the door and they check in just like at any other clinical setting, right? The person at the front desk will let them know what time their appointments are with either the doctor, the clinical team, a therapist, a social worker, a licensed counselor, the dietitian, what activities are scheduled for the day and what time those are being offered, what time the meal and what the meal is today will be posted back on the back bulletin board. So it's much like a walk-in clinic, a senior center, a counseling office, a therapy clinic, all under the same roof. So it's a wonderful concept. Now, how will they get here? It's because many seniors that age do not drive or are unable to drive. Well, we have a large van parked outside. I don't know if some of y'all saw it when you came in, but we also subcontract Quest transportation. So we have many transportation vehicles that will be driving to the patient's homes, picking them up, bringing them here, and then taking them back afterwards. So does anyone have any questions so far? No? So what's the funding source? That's always the next question I hear. Well, 99% of our participants will be Medicare, Medicaid, dually certified people in the community. If you only have Medicare, can you come here? Absolutely. There is a copay that will cover what Medicaid normally would have covered in funding, but the copay will be determined on what Medicare services you're signed up for. A, D, all of the above. So, do we offer prescription drugs? Yes, we pay for every aspect of their care. Once a patient signs on to be a PACE patient, they never pay another penny to any medical care, any medical need, any medical drug service, nothing. We pay for their meds, we pay for their DME. If they go on hospice, we pay for hospice. If they have surgery, we pay for surgery. If they need new glasses, we pay for new glasses. If they need to see an oral surgeon, we pay for the oral surgeon. So we have contracts with all the providers out in the community. So it sounds like it's incomprehensible, doesn't it? Like you're going to pay for all of that? Yes, we are. There's a catch. They cannot be signed on to another Medicare Advantage program because we are a Medicare Advantage, kind of like a waiver program. I know a lot of you know or have heard of several of the waiver programs in the community. So we're really, really excited. If you know anyone that could benefit from these services, it's a wonderful program. The PACE centers are located in 38 states across the United States. Our office hours will be Monday through Friday, 8 to 5. We'd love to, we will refer to you. We use our community partners, and we hope that you will refer to us also. If you have any questions, there's a gift bag on the table for everyone. My business card is inside. And we also have handouts. If you want to raise your hand, it goes over the PACE program and what we offer, many of the services that I just spoke about. Now, one of the wonderful things is that all PACE programs must also be an adult day health center. How many people here remember the Fountain of Youth? I do. Anybody who has parents or family members or knows a neighbor or anyone that has some dementia and Alzheimer's care and cannot safely stay by themselves, they are welcome to come here between the hours of 8 to 5. It is a state-funded program, Medicaid program. We hope copay, and we're really excited to provide this service in the community. anyone have any questions at all? Yes. I didn't introduce you. I'm so sorry.
I'm Jennifer Davenport. I'm a wound care nurse practitioner in the area. I've been with Mercy for the last 13 years, but I am now with Apello, which is under the umbrella of our providers. So if any of the patients here have a wound,
Yes.
we have a wound care service that will take care of them too.
Yes.
And ostomies, I do ostomies too, so if they have that problem, we'll have that service too.
On the handouts that's being passed out, if you'd like one, home health services is one of those services, much like if they qualify for hospice, they also can receive home health care. And within that home health care, or as a participant of the PACE, exactly right. If they have a wound, we take care of all the wound supplies, the wound care specialist, the several visits per week if needed. Usually, what is it, about 2 visits a week?
Depends on the
wound. Yes.
2 to 3.
Yes, so I'm very, very proud that we have truly tenured, experienced staff members throughout every program to provide excellent care. So, any other questions? Yes.
Do you accept a VA attendance monies for veterans too?
No, we do not accept TRICARE. It's Medicare and Medicaid.
Well, it's not TRICARE, aid and attendance is a
Aid and attendance?
It's a fine that they can get.
We only accept Medicare and Medicaid at this time. I know that we're looking, or the National PACE Association is putting forth measures to try to be able to accept other payers. But at this time, it's private pay, Medicaid, and Medicare. Yes.
So what you're saying that, the VA aid and attendance is paid directly to the client?
Yes.
So if they have Medicare, in addition to that, then they can pay that small copay?
They can pay that copay, yes. Yes.
So they would have to have Medicare and then they go co-payment in addition to all that?
Yes.
Okay.
If they're only Medicare, and they do not have Medicaid, then they'll pay a copay. If they're only Medicaid and they don't have Medicare, they pay a
Okay,
copay.
are you talking about Medicare A or B?
B,
Okay.
yes.
Do you have like home health or
Yes.
hospice do their visits here?
No, we have a community home health coordinator that schedules those visits through a home health agency. Yes.
Can you tell us who that is?
Yes, it's Trinity Home Health. They're a sister company.
And now, just because I know you are open Monday through Friday,
Yes.
do they schedule those, or do they maybe skip a day of being here at the PACE program so they can have their home health visits, or?
Yes, normally the PACE participants will come here 2 to 3 times a week outside of the adult day health program. Any other questions? These are great questions. I know that you might have some when you leave. Please feel free to take that business card and give me a call. The handouts that are being passed out has a lot of valuable information. Yes.
Do y'all take people with incontinence?
Yes. Yes.
For
Yes.
your adult day program,
Yes.
what would a typical schedule kind of look like through the day?
That's one.
I know it's kind of early
question.
still.
Yes. The schedule probably will look, well, not probably, the schedule will look like our PCAs, the ratio to patients is 1 to 5. So there'll be activities that are focused around Alzheimer's, like painting, music therapy, things such as that. And then we'll have the typical activities if they're able to attend. We have a quiet room if they become overstimulated. You know, they can go into the room and the PCA can go with them. One of the interesting benefits of an adult day health center or being a PACE center is that we must provide facilities for bathing and laundry. So we have a large, when we do the tours, you'll see we have a huge shower room and a very nice laundry room. Now you're thinking, why just bathing and laundry? because we're trying to help those caregivers as much as we can. So we can pick up the laundry and bring here, and the PCA, if the participant's able to assist or participate in, of course, we want them to be as independent as possible, and we involve them. But if not, then the PCA will take care of that and send it home that afternoon. So they can also have their bathing and their laundry completed while they're here. Yes.
Okay, you said Medicare, hopefully Medicaid.
Yes.
But then you said also that if they can't have any other managed care.
No.
So when they sign up for this program, do they revert to a managed care?
We are managed care.
Okay.
Yes. That's why they cannot be on another. If they sign up for another Medicare Advantage program, we have to discharge them. Yes.
What is the managed care? Is it PACE managed care? What's
It's
the name?
PACE.
It'll come back as PACE
Yes.
managed care.
It is PACE. Any other questions?
I have
Yes.
two. So,
Okay.
if you had, of course, like a patient that you guys went and picked up, would y'all just bring them here at 8 and they're here until kind of 5 kind of thing? Or would y'all just bring them just however they want? Is that something?
It's however the interdisciplinary team orders their care here at the clinic. And I'm glad you brought that up, because we do have an interdisciplinary team made up of 11 members, starting with the doctor, APRN, the clinic nurse, therapist, myself, quality assurance, recreational therapy, and social work, the PCA, and the transportation, and a home health coordinator. So all of these team members meet once a week on Wednesdays, and they discuss any new referrals that we have, new admissions, and we design their plan of care. In that plan of care, the average amount of times that a participant will come to the center is probably 2 or 3, unless they're with the adult day health program, and then they'll come probably Monday through Friday. The hours that are going to be the busiest here will be from 10 a.m. to 2 p.m. You know, they'll come here, they'll participate with the recreational therapist. They may go to a clinical appointment with Amanda and Chris. Then they might go to therapy and have a physical therapy, speech therapy, or occupational therapy, probably OT. And then they may meet with the social worker to complete some paperwork that's needed for the Medicaid services. You know, that's an annual thing. That's a lot of paperwork that has to be completed every year, reports that have to be turned in. So that's what the average day looks like. And they'll socialize. They'll play bingo and eat lunch.
So Patty, you said average 2 to 3. Are you talking 2 to 3 days?
Yes.
2 to 3 hours?
2 to 3 days.
2 to 3 days, and number of hours per day?
It depends on how many services are ordered. You know, if they're only coming here for socialization and nutrition, they'll be here in time to attend the morning activity that's scheduled, and then they'll have lunch here. You know, if they're scheduled, they have a clinic appointment and they're receiving therapy 3 times a week, and they're also receiving recreational therapy for socialization, and they need to eat a warm, healthy meal here, they may be here 5 hours or 6 hours that day. It just depends on each person's plan of care.
And you may have already said this, so I'm sorry, but this clinic is only open Monday through Friday, right?
Monday through Friday, 8 to 5. We're much like an outpatient clinic. Yes.
So if their caregivers work an 8-hour day, can
Yes.
they be here that much time?
If they're,
Can
yes,
they be here
they can
8
be here
hours?
from 8 a.m. to 5 p.m. They can.
Patients with dementia.
Yes. Adult day health. Yes.
I have a question that might sound weird, but which staff member is in charge of doing the bathing and hygiene for
The
them?
PCA,
Okay.
the personal care.
And so how does that work if it's 5 to 1 and they're bathing someone?
Well, there'll be more PCAs than
Okay.
5 to 1. When we grow or larger, we'll have those bathing PCAs and laundry PCAs that are assigned just to those areas. But, you know, at first we're only going to have 4 to 6 to 10 patients for the first quarter. So there's all of the rest of the team members, such as myself or the social worker or the quality assurance nurse, or even the clinic nurse if she doesn't have an appointment in the clinic that can assist with bathing and laundry. Yes.
I'm sorry,
No, this is great. I love it.
So if we, let's say we want to send a referral, or we want to refer a patient, so what's that going to look like, and who's the person?
Lori Peters, medical records. She will take all the referral information, and myself. Feel free to call and ask for Patty or Sandra or Chris or Katrina. We all will work together to take in those referrals and serve the patients in the community. Yes.
Yeah, their Medicare B plan has to be specifically to PACE managed care. It can't be Medicare B like original Medicare or anything like that.
That is correct.
Okay. All right.
That is correct. It's a wonderful program. It's new to the state. There's only 4 other PACE centers in the state. There's one in Jonesboro, one in Little Rock, one in Hot Springs, and one in Northwest Arkansas. So and I think this is a touching story, so I have to tell you. They were first looking at right outside of Hot Springs to put the next PACE center, the planning team. Michael Morton is basically the owner of all of us, and he shares that with David Northsworthy. But they were discussing, and Michael said, "No, I live here. I want our first PACE to be in this area." He cares so much about our seniors in the community that he completely changed lanes for them and said, "No, I want it here." So I am very, very proud to work for this organization. I think they serve quality care to our seniors in the community, and we hope to do the same. We hope to provide the highest quality of care to the participants. So just know that if you do make a referral, you're coming to a place where there's a team of members who truly care about their well-being, and we want to keep them healthy. We want them to have the highest quality of life that they can live at this age. And that's why I think each and every one of us are here, because we have a passion to serve this population and to bring them as much happiness and independence as long as we can. Yes.
So, with it being managed care, we project that, you're gonna be with them all walks of the season.
Yes.
So as they decline and they need more help, I know you have long-term care options too, but if family wants to keep them home, do you guys do home visits for different providers?
Yes, our home health coordinator will schedule home visits for them. Yes. And I was going to say something else, and I can't remember what it was. You reminded me of it, but I cannot recall.
Do you have openings already, or do you have those select few patients to start out with already?
No, we can serve as many as needed. They all, of course, cannot be in this building all at the same time. We'll alter to where we have no more than 125 people in the building at one time. But no, there's no quota. We do have a pending list that's just waiting for us to call them when we find out for sure our opening date. If you know of anyone that would be interested, please have them go ahead and call. As I said, my business card is in the little bag. It's on the flyers too. So, and also you can call the center, and our phone number here is 441-9491. Or stop by. Stop by and visit with us. Eat lunch with us. Come and visit anytime. Yes.
You were saying that PACE is a Medicaid Advantage program, right?
Yeah, a Medicare Advantage.
Medicare.
Uh-huh.
So
It acts as such.
do you have to wait for open enrollment?
No.
So if I have a different Advantage program and I want to come to your community, how does that work?
What you have to do is notify the current Medicare Advantage program that the participant is on. You can call or you can send it in writing. Once you receive the response that yes, they're aware and that you're going to transfer on the first day of the next month is usually if you're transferring from one to the other, it flows much better if you end their service on the last day of the month and begin our service on the first.
I feel like you might have already said, but do you guys do the transportation, or is it Medicaid?
Yes, we do the transportation. Well, we have a third-party vendor, which is Quest Transportation,
Okay.
that does all transportation. We can also take our adult day health patients to their medical appointments during the day too.
Oh, that's awesome.
You know, if they're here, we're gonna meet every single one of their needs while they're here.
Like specialty.
Mm-hmm. And our radiology, our dental and vision, we have mobile units that will come here, or if it's a specialist, we'll take them to the appointments in the community.
And does the PCA go with them to their appointment?
Yes, I'm sure that we will have a transportation PCA. The drivers are also trained in the same training that our PCAs are trained, but for quality purposes, I'm sure I'll have a transportation PCA. Any other questions? No, that's all. If you have any after this, feel free to call. We're very, very excited. We have a wonderful team. I'm so proud of our team. And our goal is just to serve those in need, and we're really excited to be able to start doing that. Okay. Well, thank
you. And you're gonna offer tours after we
Yes.
finish our introductions.
I
right?
am.
That's awesome, because I think a lot of us will be interested in that for sure. All right, so we'll go ahead and do our introductions, and I'm gonna let Ashley start first, since she's right there. Yeah, and so this is a time, if you're not familiar with us, if you'd like, you come up and introduce yourself, tell us of your elevator speech about what you do and your services, and then hopefully we'll get those all rotated through, and then we can have some tours.
All right, well, I'm Ashley. I am the Vice President for Senior Care Alliance. Just want to piggyback off of what Holly said about those committees are open. So if anybody wants to be more involved in Senior Care Alliance, I'm a chair over the liaison committee, which is, of course, more like that marketing style, just kind of going in. It's easy to do. You might be going into a clinic to take care of some business for your actual paying job, but you can also, of course, do a little plug for Senior Care Alliance. We would love that. But if you want to be involved in any of those, just pull any of us to the side and we'll get you, of course, we'll get you busy with something fun for Senior Care Alliance. My day job, I work at Mercy Rehab. I'm a clinical liaison for them, so I go out to the home, patient's bedside here, and just evaluate patients for inpatient rehab. Those folks are kind of a trigger indicating as people that are falling and weak. They don't have to have 3 midnights. They don't have to really have a whole lot of qualifications when it comes to that, especially traditional Medicare. We can admit them directly from home, usually that same day. A good way to also for them is just to remind them that we want them to be independent, and we want them to be in the community, and we don't want them to be in, of course, more of that long-term setting. We try to prevent that as much as possible. We try to, of course, refer to all you guys to get those patients took care of, and I'll just pass the baton.
Awesome. Well, I'm Candace Cox with Home Helpers Home Care. I think I know almost all of you in here. We cover 7 states. We do the in-home care, assistance with activities of daily living, ADLs, IADLs, that kind of stuff. We do private pay, long-term care insurance, Medicaid, and VA benefits. We do have programs that help people if they need to get set up with their VA providers or get their services going. We also have an eligibility team that helps people if they need to get on their Medicaid programs. And like I said, we do cover the entire state of Arkansas, the eastern part of Oklahoma, and then we have 6 other states. So I'm going to say my phone number, 479-316-4639. And if you have any questions or anything, you can call me or text me. Thank you.
I'm Sarah Floyd with Home Instead, so we do pretty much the same thing Candace said. We do in-home cares, cooking, cleaning, laundry, whatever you need, taking to doctor's appointments. We do go into all the facilities also, and so we can go into any facility and take care of somebody if they have come back from surgery or they need more care. And so if you need us, just give us a call at 479-434-6960.
Good afternoon. I'm Teresa. I'm from Van Buren Legacy in Memory Lane.
And I know a lot of you know what we do. We have independent living and secured memory care units. But we are also opening a assisted living in February. And we have some, it's going to be private pay, but we do have some affordable rates. We even have a shared private room suite, so that makes it more affordable. But also, like they were talking about the aid and attendance, which that would cover that if they were a VA, they would cover the assisted living, even though it was private pay. It would help with it. And our memory care, we do have a Medicaid waiver and also private pay. And of course, the independent is private pay. But if anybody needs our services, my number is 479-262-6466. Thank you. And if anybody needs a little handout, I have some handouts.
Hello, I'm Brittany with Heart of Hospice. We do palliative and hospice care in our area. We do have an agency in Oklahoma that provides hospice care only. So I think a lot of you guys know we don't have to have a physician order to get services started. If you have a loved one or concerned about someone and they're agreeable to learn about resources, give us a call. We can get a nurse out there and see if they meet requirements to get them services started right then. My number is 479-462-7932. I also want to mention too, I'm part of the general meeting committee. So I'll be reaching out to confirm if we have anything set up in the future. I think we pretty much have all of our speakers filled in and dialed in, but things change. People get busy, so if you're wanting to provide some education to the community in this type of setting, reach out to me so I can have you like on speed dial if I need to fill in a slot. So thank you guys.
Hello, I'm Tanya Hagler. I'm with Elite Home Health, where we provide skilled home health services in the home, nursing and therapy. My phone number is 479-494-7273. Thank you.
Hi y'all, I'm Cassie Barnes. I'm from the Blossoms in Van Buren. Crystal is from Fort Smith. She's back yonder. We are a long-term care and skilled facility. We do VA contracts. We offer memory care units for male and female. My number is 479-670-0073. Thank you guys. Have a blessed day.
Hi, I'm Mandy Kirkendall. I'm a recreation therapist and memory care program coordinator at Brookdale Senior Living. We're an assisted living community. We have a lot of assisted living rooms, and then we also have a secure memory care program. If you're interested in that, our number is 479-484-5556. Thank you.
Good afternoon, Cindy Anderson with Encompass Health. I am here, I'm the business director. We are an inpatient rehab hospital, very similar to Mercy. We've been here for 35 years in the River Valley. We are known for physical therapy, occupational therapy, and speech. We have 170 hospitals across the nation. Our goal is to get people back home and to be as independent as possible. And so with that being said, we are achieving our 85 plus goal for 2025, and that is our goal to do better than that for 2026. So we are getting people back into their homes. So 479-551-4770 if we can help. Thank you.
I'm Cindy Taylor, Mercy Crest Assisted Living. We have 102 beds with a 20-unit secured memory unit here in Barley. We have independent assisted living and memory unit all combined. So give us a call. Our number is 479-478-3000.
I'm Edward Ellis, and I'm representing two different organizations today. Mercy Hospice, I've been with them 14 years as a social worker. I love them. They're the most compassionate nurses I've ever worked with in my life. They're like family, and when they go into your homes, they're like family with your homes. One of the things that I do, I'm a Vietnam vet. is I've always tried to make a policy that no veteran dies alone. And so I try to sit in homes when veterans are dying and try and take care of them so that they're not dying by themselves. I worked on the floor for years and made sure that no one died on the floor that was a veteran alone. So that's what I try to do, and that's what I try to say. And Mercy's just been good to me, and they'll be good to anybody else that they service. The other one is Collie Care House. It's something you're just going to start hearing about now. Chad Collie was a veteran. He was injured in Vietnam. He was an officer. And his last wish is that we would take care of people, somebody would take care of the vets as they're going through the dying process. So we're opening a house, so in the Collie Care House, opening a house so that people that cannot afford or have not the ability to be in a house while they're going through the dying process, it's free of charge, totally taken care of by donations. We'll have, right here at the cottages, we'll have a cottage at the front. It'll have 3 rooms. You can service 3 people. It don't have to be a veteran. You can be just anybody that just don't want anybody to die alone. And there'll be no charge to them at all. We'll have 24-hour care there with them for them and take care of them at no expense. So that's the 2 I represent. I know it sounds morbid. That's what I work with is death. But I'll tell you what, it's a beautiful time to minister to people.
Last but not least, I'm Kelsey Salee. I am, Okay, I am a property and casualty insurance agent here in Fort Smith with BHC Insurance. I'm kind of like in both directions. So I'm also a psychiatric nurse practitioner, and I've practiced for 9 years. I spent the last 5 years in the River Valley. So if you guys were calling on us, I see some familiar faces. You may have spoke with me before, but somehow this is just God's plan for me, and it all just kind of came together. And I actually spoke at the Senior Care Alliance conference last September, and that's how I became associated with the Senior Care Alliance. And the conference was just so enlightening and refreshing for me that I love it. And I love the ability to connect people when they need it, because we're stronger together as a community. I've spoke with Luis and Holly a lot, and they're like, "You want to speak at a meeting?" And I'm like, "Okay, I can talk about vitamin deficiencies and all these things." And they're like, we also want to know about what you offer as an insurance agent. I'm like, "Oh yeah, okay," because that is my primary role. And I look forward to speaking at the next general meeting in February. And the content is actually really, it's been fun to work on and pretty refreshing, because that is one area that a lot of us aren't educated on. Before I transitioned into my career in insurance, there was a lot I didn't know, and there's a lot that's important, and a lot that we can do as community members or healthcare members to advocate for people, and also to protect ourselves when you're providing care. So I do look forward to that, and I'm helping with the Senior Care Alliance Conference Committee, so hopefully we'll get some really good speakers. It's going to be hard to beat last year because there were a lot of good ones, but I'll give y'all my cell phone number if you want it. It is 479-652-0492. That's 479-652-0492. If y'all have any questions, it doesn't matter which side it's on. As far as insurance, or I'm not actively practicing, though I have my independent practice license, I can get you referred to some of my really great colleagues. And we have River Valley representing back there. They were an amazing employer for me for 5 years and wouldn't change it for anything. So we have a lot of great psychiatric care there. They can be helpful for the geriatric community. It's really important to fine-tune those meds as well so that they feel good.
That's hard to follow. 25th, and Kelsey's going to be our presenter about, also talking about mitigating risk, right?
Yes.
Something that we all should learn more about every day. And then the other thing I'd like to let you guys know is Legacy Heights and Memory Lane is sponsoring a business after hours on February 10th. How many of y'all have ever been in our business after hours? I know some of you have. We have a lot of fun. And Teresa is our chief charcuterie board extraordinaire. So that'll be at 5:15 on February 10th. I invite you to come out for that. And if you would like to have a tour of this beautiful facility, please stay so we can get those done. So thank you guys for coming. I look forward to seeing you so much in the future.